Today, we are diving deep into the powerhouse of your body, the hip. I mean, it's this engineering marvel that can handle incredible force, but for so many people, it's also the source of this mysterious, nagging pain. We're going to uncover why it hurts and just how powerful it really is.
Okay, let's just jump right in with something a lot of us might know all too well. That vague, deep ache, maybe in your groin or on the side of your hip. You can't quite put your finger on it, but you just know something is off. Well, that feeling, that's our first big clue in this whole investigation. So that pain and how people point to it is actually a massive signal for doctors. It tells them, hey, the problem probably isn't the back. It's not just a muscle. It's a sign that something is going on deep inside the hip joint itself. And it has a name, the C sign. You know, if you've ever found yourself doing this, instinctively cupping your hand in a C to show someone where it hurts, you were literally pointing right at the source. It's a classic sign that tells us exactly where we need to focus.
Okay, so to really get why that pain is happening, we've got to look under the hood, right? We have to look at how the hip is actually built. What makes this joint so incredibly strong, but also so prone to these very specific problems? The clues are all in its design.
At its most basic, the hip is what we call a ball and socket joint. Super simple concept, right? You've got the ball, that's the top of your femur or thigh bone, and it fits snugly into the socket, which is a part of your pelvis called the acetabulum. This design is what allows for that amazing combination of movement and rock-solid stability. Now, a great way to understand this is to compare it to your shoulder. The shoulder is also a ball and socket, but that socket is super shallow. That's great for, throwing a fastball, but it's also why shoulders dislocate so much more easily. The hip, though, that deep socket gives it this incredible built-in stability. It's designed from the ground up to bear weight.
And it's not just the bones doing all the work. The hip is wrapped up in this web of incredibly strong ligaments. I mean, one of them, the iliofemoral ligament, is one of the strongest in your entire body. Its whole job is basically to keep you upright and stable without you even thinking about it.
Okay, but the story gets even cooler. Beyond those big bones and ligaments, the hip has a couple of secret weapons, you could say. These are the unsung heroes that play a massive role in keeping everything healthy and working right.
First up is the acetabular labrum. And look, this thing is so much more than just a simple ring of cartilage. It actually makes the socket deeper for even more stability. It creates a kind of suction seal to keep joint fluid in. It absorbs shock. It even sends feedback to your brain about where your hip is in space. It's a total multitasking marvel.
And then there's this little guy, the ligamentum teres. For the longest time, people thought it was just kind of there. But now we know it's a critical stabilizer. A good way to think about it is like the ACL of the hip. It provides that extra bit of security, especially when you're in positions where the hip is a little more vulnerable. All right, so if the hip is this anatomical fortress, this masterpiece of stability, why does it go bad? Why do so many of us end up with that nagging pain? Well, a lot of the time, the problem starts with tiny little imperfections in its shape, which then get stressed by, just living our lives.
One of the most common issues is something called Femoroacetabular Impingement, or FAI for short. And that's just a fancy way of saying there's a fitting problem. With the cam type, the ball isn't perfectly round, so it kind of jams into the socket. With the pincer type, the socket has a little too much bone, so it pinches down. But either way, you get the same result: pinching, pain, and eventually damage.
And what about that audible snap or click some people feel? That's called coxa saltans, or snapping hip. And it's not just one thing. It could be a tendon snapping over the bone on the outside, or a different tendon snapping over the front. Or it could be a sign of something deeper, like a tear in that super important labrum we just talked about.
So what's the tipping point? What takes these small anatomical quirks and turns them into real problems? The answer, really, comes down to physics. It's all about force. The incredible, just relentless forces our hips have to deal with every single day.
Just take a look at this number, 4.5 times. Let that sink in for a second. What does it mean? Well, it's a multiplier. It represents the insane amount of force your hip joint has to absorb when you do something as simple as going for a run.
This is wild. Look at this. Just standing on one leg, not even moving, puts 2.5 times your body weight through that one little joint. But then, the moment you start to run, that force just skyrockets to over 4.5 times your body weight. That is a massive load for any structure to handle, step after step after step.
So here's the big takeaway.
The hip is an absolute engineering marvel, right? It's built to handle these huge loads. But it's those very same forces, repeated over and over again, that can expose any tiny weakness. A bone that's just a little bit off shape, a ligament that's not quite as strong, that's when you go from a stable joint to a source of chronic pain and wear and tear.
So that brings us to our final thought. The next time you stand up, walk across the room, or go for a run, just for a second, think about the incredible physics at play inside you. Knowing what you know now about the immense forces your hips are dealing with, does it change how you think about that simple act of moving? It's something to chew on.